About 10% of patients does not get a good result when the treatment, course of treatment is aging disease. Because if you don't examine this patient, and many of them were examined in a sloppy manner, and determine that this patient really has a problem somewhere in the body, and don't deal with it, then the patient is not going to get a good result. Because in medicine we know, every human being has one weak system in the body. Of these 15 systems our body is made of, everybody has one system which is weak. No exception. Superman doesn't exist. My weak system is digestive system. That starts from the teeth and ends at the other end, and so on and so forth. I have always had trouble with that, so I know it. So obviously when I am getting a treatment, I always, take care of it, so to speak, get the cells from different organs where I think there is a problem right in there at that period of time. Okay, so this is this is sort of important to understand that the art of cell transplantation is not only art of preparations in the laboratory, but it's an art of how to use them in clinical practice. So one needs to go back to the medicine it used to be practiced when I was young, okay? When we were, trained to make diagnosis without all of these fancy tools by talking to the patient and examining the patient. That is the key, you see. And when I came to the United States and I voluntarily repeated my training in surgery, I had 17 colleagues around me that kind of used to irritate me, and I one time told them, listen guys, you see there is a big difference between me and you. I can practice medicine in Black Africa too, but none of you can, because I don't need laboratory, I don't need CT scan and all of that. I can use my brain and my 5 senses to make a diagnosis by looking the patient at the door. I'm bragging, but this is how medicine used to be practiced. I'm not saying that the CT scan is useful sometimes, and so on and so forth, but it is first of all dangerous. Number 2 is also that it's abused. It's used for every little thing. It's used to cover sloppiness of a doctor, or the fact the doctor is now forced to have 15 minutes only to examine a new patient in his practice. Now, as an internist, that is humanly impossible, okay? When I was, in private practice in the United States, it was 2 hours. Now, after 2 hours, you get a report that I, as a surgeon, can use, and I don't have to ask patient much questions, you see. But after 15 minutes, I have to do the work of the other guy. This is what is wrong with the system here. And I don't know who is behind it, but I'm just telling you what is the reality. Yeah. I don't know how anybody can practice medicine like that. There is only one area, as I already alluded to, where we beat Germans, in terms of the results, by what we accomplished in Russia. And that is in treatment of neurodegenerative diseases, you see. Germans were never feeling safe enough to implant cells into the brain or into the cerebrospinal fluid around the brain, you see. Past the age of 11, you cannot treat a neurologic patient unless you implant cells into the cerebrospinal fluid via lumbar puncture, okay? The moment, because why past age of 11 you cannot get cells into the brain, because there is in our body something which is called blood-brain barrier. The blood-brain barrier you are born with, but it is incomplete until the age of 11. So in children you can implant cells anywhere and the cells will get into the brain. But after the blood-brain barrier is complete, after the age of 11, you cannot accomplish it. You have to bypass it. And the simplest way, most commonly used in medicine, is via lumbar puncture, okay? Once you get cells into the system, it's about 750 cc of fluid, which is very active, is totally exchanged every 24 hours, and is circulating around the brain, inside of the brain, and the spinal cord all the time. Once you get your cells in it, they then will find a way. Then the principle of homing starts again. In other words, you have a patient with Parkinson's disease that has trouble somewhere inside the head, you're doing via lumbar puncture, you can be rest assured that the cells will go where they belong. Okay. Now, without our ability to develop cells which are safe to be implanted into the intrathecally, as we say, or the via lumbar puncture, you cannot get anywhere with treatment of neurological disease in any patient past the age of 11. So this was very important, and that tells me, of course, that how high quality these cells become after 11 days long primary cell culture. That you can afford to do that. Now, of course, the first people that started to do this primary tissue culture were Soviets, indeed. Okay, and that's why that was the place we were able to launch this treatment of the neurologic patients, and that's why it has never been done anywhere in the world except those patients in the West that have been treated with our cells in variety of locations. Now these cells naturally, if you need to, but it truly is very rarely necessary, you can implant them any way you want. For example, as I mentioned to you, in patients after heart attack in France, they were implanting them by catheterization, into the coronary arteries, and going into that branch of coronary artery which was actually blocked. You put in the stent, open it up, and then you implant the cells, and so on and so forth. And you can, put them into the vein, the portal vein, to get them very fast in the liver in patient, in case the patient is in deep trouble. You can inject it into some lesions in the bone if it's necessary, or you can inject them into the joint space. Anything which is. But all of these things are nice surgical exercises which are truly not necessary, because the principle of homing really works. And you use some of these special methods of implantation only when you are running, when you don't have enough time. See, because the point is, you have asthma, and you get something intravenously, and you breathe normally. You see, now cells don't work like that. Cells need their time. Okay, the older the patient is, the longer it takes before you see the therapeutic effect. Now, if you are treating a 2-month-old child with Down syndrome, the patient's parents start to notice effect 2 weeks after treatment. If you treat the patient who is 70 years old, has never been treated before, okay, this is first treatment, it may take up to 6 months before you see the therapeutic benefit. So in this way, this is very different. But at the same time, the combination, what you see from cell therapy is something which, regardless, you can give patient 25 different medications. It's not going to be the same as you can accomplish by one stem cell transplantation, which may last, shall we say, the whole treatment may last 15 minutes, and then you have to wait, but the effect will be there. So these are peculiarities of the different treatments. What are the indications? As I told you, in principle, any incurable and treatable disease is practically considered, a candidate for treatment. But when it comes to real life, we have kind of a little classification list here. Complications of diabetes, particularly type 1, that has been of great interest worldwide, because the number of such patients is growing, by the day, and even rich countries have a hard time to cope with it financially. Okay, and this was truly in Soviet Union the one and only project that was financed by the government. That was a governmental project. That's why they did so much, accomplished so much in this field, which basically we used to benefit from. When you have a patient with retinopathy, okay, If the patient is diagnosed with retinopathy, he should receive treatment immediately, because you cannot cure retinopathy. You cannot reverse the condition back to normal necessarily. You are happy if you keep the patient in the same condition, so you stop further progression of the disease. If you get improvement, that much better, but that is not what this patient promised. You will not treat patient who is blind. Too late. Next, nephropathy. Every patient that starts to have, a lot of protein in the urine must be treated, as soon as possible, because they're only going to get worse. But when the patient is already on hemodialysis, too late. You cannot bring them back. It has never happened. Okay? Do you have a patient who has tremendous pain in extremities that nobody can help, and so on and so forth? That 98% success rate. And in these others, the success rate varies depending upon how far is patient gone. But still very remarkable. Because even a patient who is already on his way to be blind, you can still in 60% of instances stop it. And keep it that way by repeating the treatment whenever necessary. Whenever necessary will be determined by ophthalmologist. You cannot predetermine it by, okay. Endocrine diseases, when the hormones don't work. Okay. Treatment of infertility. There is no treatment for male infertility. None, even today, except for cells. Female infertility is a solved problem in most of the cases. And then you have the so-called early menopause. Growing number of women, get into menopause at the age of 35. And hormones don't work very well in most of these cases. Stem cells will. And these are all the stuff that I'm talking about are the items, are the groups of diseases which have been proven. So there is no question about it. Immune deficiency disorders. I mentioned to you about AIDS, and cancer and so on and so forth. That has been all proven beyond doubt. Aging disease, very huge numbers. Neurodegenerative diseases, I don't have to add. Degenerative disease, any liver, heart and all that all works. Genetic chromosomal diseases. Very latest thing is autism. I am the first one who treated autism, and it works like a dream. Nobody else did it. And I'm saying that every autism is caused by the MMR vaccination of real autism, regardless what anybody says. You don't treat patients who are on deathbed, too late. And you are not treating the patient that is extremely exhausted. You have to kind of, put some life in the body first, all right?